Hello, everybody. My name is Dan Jones. I'm an inspector of the Edmonton Police Service, but I'm also a researcher and a PhD candidate at the University of Huddersfield. Here to talk today about something I call universal precautions for health for trauma. And I just want to go over a few things before we get there. So the project I'm part of has interviewed over 800 incarcerated men and women, and we have found some interesting findings when it comes to trauma. Now, just to kind of give you some context, the Canadian prisons system has roughly 40,000 people in it per day. On average, obviously, that's a moving scale. And we have a federal system, which is people incarcerated for 2 years or more, and a provincial system, which houses incarcerated individuals 2 years or less, and also our remand, people awaiting trial. Our research touches on both federal and provincial samples. Now, when you start to think about incarcerated people, there's the concept that people need to be punished and all that kinds of things. One of the things we started to really look at was the victim offender overlap. What we found is 95% of men and 97% of women experience victimization in their lives. Now, oftentimes when I talk about this in different rooms, specifically around justice, actors, and systems people, they say, of course they've been victimized. They are living a criminal lifestyle, and they've obviously had issues in relation to that. So when we look at that victimization, overall, all 82% of men and 83% of women experience their first victimization prior to their first detected offense. Now, when you start to listen, really listen to the nuanced conversations that these individuals are having, they talk about victimization, and one of the quotes that I think is important is, I know how to be in a abusive relationship, I don't know how to be homeless. And that concept is about choices, and people often talk about people make choices, they make bad choices, and I'm not saying that people don't make bad choices. I'm saying sometimes the choices that they make are impossible choices, choosing homelessness or abuse, and that's a tough thing to get to. These are matter-of-fact stories for these folks. They talk about victimization like we talk about going for lunch. Participants did not try to excuse their behavior. This was never like, I'm in here because of this, I'm in here because of this person. It really was a unfortunate, just a regular part of their lives. And sadly, most of them had this worldview that I did the crime, I'll do the time, and I'm not worth investigation. I'm not worth having my investigation taken care of. Oh, the sad part about that is the vast majority of these victimizations started in childhood, started prior to their first detected criminal offense, started prior to their entry into the criminal justice system. But for some reason they conflate the two, their own personal experiences of victimization and their own criminality, and they basically talk about basically the feeling of it's their fault. When you look at housing, 73% of the women and 43% of the men in our federal sample, anyway, have experienced homelessness. There's a trauma to that. There's a trauma to not having a place to live, and the trauma that occurs with living on the streets. One of the issues that we've discovered is drug use is oftentimes used for safety, which sounds insane, but when you use methamphetamines so you don't get raped and you stay awake, and when you go to prison, you talk about how I don't have to use drugs anymore. I don't have to use drugs right now. It's not this strong desire to use drugs. It's at times it's their only option of safety. And then people getting released out of prison oftentimes get released into precarious housing or get released into homelessness, and that becomes an issue. And that becomes the issue of a contextual benefit of prison, if you will, where prison is the best part of them. Of the places for them. Substance use, drugs, psychoactive substances, illegal substances. 82% of all men and women in the sample report using drugs outside of prison, and 49% of them admit to using drugs inside of prison, with the women in our sample being a little bit higher in both of those instances. When you start to look at drugs, like I said, there's reasons for drugs, and there's obviously sometimes it's to mask something else. It's to numb yourself from pain, and it's really about, let's change the conversation. Let's start talking about what this is, because the drugs are often a symptom. The use of drugs are a symptom. The criminal behavior is a symptom. It's a symptom of trauma. It's a symptom of what we have is traumatic experiences. So it's about to change. We need to change the conversation. We need to start talking about average childhood experiences, trauma in childhood, trauma, pain, and understand. Let's start looking at root causes. Oftentimes, when we start to deal with things from just a justice lens, we really are a Rolade or an antacid tablet for pancreatic cancer, because we're treating the symptom and not the cause. We really do need to start partnering with public health, education, fire, emergency medical services, police, and everyone to be trauma informed and trauma aware. To understand that we're dealing with individuals who are suffering from a traumatic experience, often multiple ones throughout the course of their lives. You know, if you look at most police agencies and social agencies across the board, everyone has these strategies, if you will: opioid strategy, a methamphetamine strategy, a housing strategy, a poverty strategy, a homelessness strategy. Well, I can tell you by the interviewing 800 people incarcerated that a lot of these folks fall in multiple strategies. So we can't treat them for one thing and not treat them for the other, because that would be, again, where we're just treating symptoms. Homelessness, substance use, criminality, even poverty can be symptoms of trauma. So you see the slide, the universal precautions. So when we teach people first aid, we teach them to wear PPE, personal protective equipment, masks, gloves, eyewear, and in that, we're doing it to protect the individual when they offer first aid, and we're doing it to protect the individual who's getting the first aid, to ensure that they don't get a bloodborne disease or COVID, if you will. Right now, Canadian statistics show that 0.6% of the population has hepatitis C. 0.006% of the population has HIV. 2.17% of the population is tested positive for COVID. I'm going to go back. 95% of men and 97% of women experience victimization in their lives, the individuals that are incarcerated. The one thing that's for sure about the 40,000 individuals that are incarcerated is the police have dealt with every single one of them. Correctional Services has dealt with every single one of them. The courts have dealt with every single one of them. But we've not trained our people or taught our folks in these justice systems about trauma, what trauma is and what the impacts are, and how to be trauma aware and how to be trauma informed. And the fact that if we do, and we treat people, you know, if we're going to wear PPE when we do first aid, why wouldn't we think about that universal precaution for trauma when we're engaged in the concept of the criminal justice system? We need to understand the impact that we're having on people. We also need to understand the backdrop of the systemic failures that actually compound or increase trauma. I talked about housing. There's a lack of stable housing. We need to work on that. Personal security. If you need to use drugs to stay safe, that's a problem. Lack of services to manage addiction. We often have a linear response to addictions, and it's a abstinence-only programming, when we really got to start to think about, is that what we need to address, or are we thinking about things like cognitive behavior therapy? One individual in our sample was on a list for 3 years waiting for cognitive behavior therapy, so she went and robbed a bank, waited for the police, pled guilty at first appearance, asked for a 5-year sentence, because she found out she could get cognitive behavior therapy in a federal prison, and that is a concern. Lack of services to address mental health issues. A lot of these individuals have comorbid mental health and substance use issues, and we're not addressing them, and we need to really start to look at what we're doing. And difficulties in obtaining medical care. You know, Canada is a country that offers free medical care, but oftentimes individuals who are homeless or precariously housed have trouble getting those needs addressed. So the main thesis for my topic here is, let's look at trauma, and let's use universal precautions in order to address that, so we can better serve a community of individuals who are often underserved and over-criminalized, and maybe we can make an absolute difference in their life. Thank you. Have a great rest of the conference, and we'll talk soon.